Hi, this is Dr. Alexander at All Creatures Animal Clinic, and today I'm going to show you how to administer insulin to a cat that is diabetic. You're going to need a couple of different things. You're going to need your insulin. You're going to need your insulin syringes. They'll come in a box like this, bags, and then you get the individual syringes out here. This particular insulin is our preferred method for cats. Many times you'll have a bottle that looks like a vial bottle like so, and that is pretty much the same technique that we're going to show you here. Our favorite method for cats is to use what's called a Lantus Solo Star pen. Glargine or Lantus is one of the most common types of insulin we prescribe for cats. It comes in very large vials, which are hard to get all the way through. You end up discarding a lot of medications. So they make these Lantus Solo Star pens. Now these pens have insulin in here in this little vial inside the pen, and they're meant to be given with a little applicator tip that has a needle on it, and you dial the dose you want, apply it, depress, and that's how they're designed to be used. And that is fine. The problem is that that is not as consistent for cats, and you also have to hold the injection still for about 10 seconds, which many cats will not tolerate. So what I prefer to do is to just use this like a vial, forget about the rest of the pen features, and use this as a smaller vial of insulin. So you'll want to take your insulin syringe. This is a normal human type of insulin, and all human type of insulins use what's called U100 syringes. You can see that on the side, U100, because this is a U100 type of insulin. There are types of veterinary specific insulin that require a different type of syringe called a U40. It's just important not to get those confused. But at a human pharmacy, you will only be picking up U100 insulin syringes and U100 types of insulin. It has the orange top, that's how you know you get the right thing. This particular syringe size is 30 units, so it goes up to 30 units here. There are larger ones, 50 and 100 units, that can be used for a pet that's on a large dose, but for cats, you usually are working in just a few units at a time, and you want to get the smallest size, which is the 30 units, so that you can see your markers better. So what you do is you go ahead and take off the back part. That is just to keep the stopper in place. You can discard that. And then you want to take off the cap. And you'll see there is a very tiny, very thin little needle on the end there. And you're going to go ahead and take your Solo Star pen and hold it up just like a vial and insert this in. There's actually a cool trick. You can draw up your dose ahead of time. So if you want 1 unit, you draw so that the top of the black is at the 1 unit mark there. And that's how much insulin I'm going to want to draw up. And then if you have the air in there and you just insert it into your pen, it will usually fill it up for you, and it'll just pre-fill it. It can be hard to see, so if you're not sure, what you can just do, whether you've made an air bubble or not, is you can pull up the insulin and pull up more than you need, flick out any extra bubbles to make sure those come to the top. Bubbles will really change the size of your dose because we're talking about such small amounts there. And then slowly push that up so all the bubbles go back up into the vial. And then bring the top of your black at your 1 unit mark, or 2 or 3 or 4, whatever your particular pet needs. And then go ahead and pull it straight out. Now you've got your syringe and you're ready to go with your cat. Sometimes you want to have this safely recapped so that you can have it waiting for you while you get your cat ready. To safely recap a syringe, you're going to go ahead and slide it into the syringe and then grab to the syringe cap and then grab the cap by the base until it's secured in there and leave to the side so you can go get your cat. So Kelk here is diabetic, and he's going to be receiving insulin injections. I have already pre-drawn up my insulin into my insulin syringe and I'm ready to go. And so I want to get him into a comfortable location. If he is fighting me on this or not wanting to be here, sometimes it can help to have a towel as a bit of a bib. It helps to kind of wrap it in front of them because you still want to be able to access their back and just kind of keep their paws out of the way. And then you'll be able to access their scruff area. The scruff area is the shoulders here. You can see there's a lot of loose skin, and the skin here is fairly tough and doesn't feel the injection quite as much as other areas. So to give my insulin injection, I'm going to go ahead and grab a pinch of the skin somewhere on his scruff. A nice little pinch, and I've got skin between my fingers. I can feel it, not just fur. And then you can make a little tent in between that pinch of skin. This is something that's easier felt than seen here, unfortunately, but you'll be able to feel a little tent between the folds of skin. And that's where you're gonna put your insulin syringe. You're not gonna be able to feel it completely distinctly because the needle is so incredibly small on insulin syringes. So what you're gonna wanna do is make your tent and then push the needle all the way down so that the needle is in and the plastic part, the hub, contacts the skin. Then you want to give a very slight pull back on the syringe. You're just looking for a flash of blood. It is incredibly uncommon to get blood in these syringes. There's very few large vessels in the skin. But if you were to get blood, you would just discard that, not inject, discard that, and start over. No big deal. So I can go ahead and show you there. I take my cap off. I've got the tiny little needle here. Usually you want to put this in with the bevel up, meaning the pointy part down and the flatter part up towards you, but it actually doesn't matter too much with an insulin syringe because the needle is so very sharp. I'm gonna go ahead and make my little tent of skin, and I'm gonna use my finger to find my little tent between that pinch, and then I'm going to insert this until I feel resistance, and that way I know that the needle's all the way in. I'm gonna gently pull back. I didn't see any blood, so I'm just gonna go ahead and push all the way down on my syringe here. And it often doesn't feel like you really did anything because the doses are so small.